Although most children and young people grow up with good mental well-being, a growing number experience mental health difficulties such as anxiety or depression, which may require support from mental health professionals. Over many years of research, several treatments have been developed and evaluated which can be effective at helping address these difficulties. However, there are several barriers to accessing these treatments. One of these barriers is that research reaching the real world can be a very slow and complex process. This means that many children and young people do not receive the mental health treatments and support that they need to make them feel better early enough. Clinicians, researchers, and those commissioning children and young people's mental health services face a range of difficult challenges. This includes lack of resources, time, and funding dedicated to implementation of evidence-based practice in mental health services. Evidence can be inaccessible, with papers often behind paywalls, and it's hard to stay up to date with new emerging evidence. Clinicians often have limited capacity to translate research to their clinical practice. When it comes to research, factors including high research costs, lack of implementation-specific funding schemes, and lengthy research processes are barriers to implementation. Researchers often have a narrower focus on evaluating treatment effectiveness and do not always have the skill set or resources to embed interventions into practice and policy. There's also no consistent and shared data source or recording system for mental health services, meaning that we lack a full picture of treatment outcomes. This can make it challenging for commissioners to know what interventions are working well and what to commission. Despite these challenges, there are many things we can do to improve the process of implementing research. These include things like involving young people in treatment design and research so that we can learn from their insights and reflections based on their expertise by experience. Involving clinicians in research projects from the beginning to make sure the research is relevant and useful to their clinical practice. Funding schemes that are quick to respond to research and implement the findings into real-world settings. Open and accessible research, which may involve making research papers and findings freely available online. Creating easy-to-understand reports and videos and sharing with a wide audience. Improving the availability of effective treatments in mental health services is attainable, but requires practical and collective efforts from those professionals working in this field, including researchers, clinicians, government policymakers, decision makers, and leaders. By working together, we can help improve the mental health and well-being of children and young people. For more information, visit emergingminds.org.uk.